This is HRS TV. I'm Jessica Mullenix, and today I'm joined by Dr. El-Assaad and Dr. Beach, representing at HRS 2025 their abstract regarding pediatrics and WPW. They're both pediatric electrophysiologists, which I just find incredible. Women in EP, thank you for joining us today.
Thank you for having us today.
I'd like to hear, can you just give our viewers and myself a quick overview of what you're presenting today regarding WPW and what you found from this amazing registry?
Yeah, absolutely. So our project focused on assessing the recurrence rate in pediatric patients with WPW who underwent an ablation procedure for accessory pathways. And we really wanted to provide the patients and the parents an up-to-date data on what's the recurrence rate nowadays, right? And we also wanted to look at the risk factors that were associated with higher recurrence rates. And so as part of the registry, we identified 315 patients who had an accessory pathway ablation and at least one follow-up. And of those, 53 patients had actually recurrence, which was surprising.
So that is a large percentage.
That is a large percentage. That comes up to be about 17%. But this is, real world data. This is based on multicenter, and a large multicenter and contemporary data set, because data was collected between 2017 to 2024.
I think that's so important, because we are talking about current technology we use. Impressive.
Correct.
And that's a very large study.
Correct. And so then we delved into what are the factors that were associated with recurrence.
Exactly.
And we found a couple of things. In univariate analysis, it turned out that pathway location was important. So interseptal pathways were associated with higher recurrence versus left lateral were associated with lower recurrence.
Interesting.
But also more importantly, having congenital heart disease, and specifically Ebstein's anomaly, had the highest odds ratio in terms of association with the recurrence. And then follow-up time, of course. You follow up patients. What we're learning also is that, what historically we used to do is that do the ablation, follow them up to 1 year, and then discharge them.
Right.
But I think all of us have had recurrences after the 1 year follow-up, and so now we're following up them longer, and that's what we saw, that the follow-up duration also matters. You follow them up for longer, you're going to find more recurrences. And so then we plugged these variables into a multivariable model, and essentially what turned out to be the most significant predictor is having Ebstein's anomaly, which that part is honestly not surprising. As pediatric electrophysiologists, we all struggle with ablating these patients because of the anatomical changes involving the tricuspid valve and the changes in the electrophysiological features during mapping. And so ultimately, what we learned is that, I think we do a good job. It's not the best that we all want, and there's definitely still more work that needs to be done.
So that leads to my next question. It sounds like what you're saying is we found something that was a little surprising, but it's science that's going to guide our practice. So can you talk some about what you think our next steps, where's this science taking us?
Mm-hmm. So it was very interesting for me. It was actually a little bit different from what I thought the results might be. I personally struggle with a different location that came out in the analysis. So I thought it was very interesting.
That is true.
To see the results that we had. I'll also note that I think once we have longer term follow-up for these patients, just as Dr. El-Assaad was saying, there are more recurrences that happen over time. And so there's still really interesting data that are going to come out of this registry that we have. And I wonder over time if we're going to learn even more about the recurrences that come up, the particular locations, perhaps with later recurrence than we're seeing in other places. And also, just like you said, should we really change our practice?
Right.
We've been talking about this at recent HRS sessions. I think last year in 2024, there were some conversation about whether we should follow patients for a little bit longer, even at intervals that are relatively spaced out. So we're really rethinking our practice with these data from this registry.
And so something else I found very interesting about the registry, and we have another video about how the registry was collected, but it's really a community involvement. So many centers were involved in this. And I realized that with the PACES program, your patients are very involved and willing to be parts of these studies. And so is this already kind of made its way out to your community, your EP patients? Like, what do they think of this?
Yeah, that's a great question. I don't think so yet. In terms
It is
of
late
like,
breaking,
yeah. But I think it'll be interesting, once it's published,
That's
what
true.
people think of it. When we counsel patients, like we still use that less than 5% recurrence rate, and it really, the results of the registry, made me rethink that, right? Like, are we, counseling? How do we, counsel our patients?
We can individualize
Differently,
it better.
right? Exactly. And I think I do counsel Ebstein's patients very differently than patients with structurally normal hearts.
That's incredible. And we could talk so much longer, but we are here in beautiful San Diego, HRS 2025. This is up HRS TV, and we will have more presentations later about WPW, and I hope you can join us for those.
Thank you.
Thank you.